So we've talked a lot about health promotion, and now we're going to talk about disease prevention, which I know, being a nurse, that you're very aware of this process and what's required in the teaching in each piece. Disease prevention, of course, measures not only to prevent occurrence of disease, such as risk factor reduction, but you also are trying to help arrest the disease and reduce its consequences once it's established. So it's really about dealing with the disease itself instead of the health promotion piece on the front end. But it really has the three levels, of course, with the primary level, and that would be preventing the disease through health education. The secondary level, which is really when you get into the early detection phase where you're providing some education, of course prompt treatment, and working on changing risky behaviors or behaviors that might lead to the health risk. And of course the tertiary issue when the person has been diagnosed and now they're going through treatment, and you're working on the rehabilitation to restore health and limit disability and just get them started with rehabilitation. So now I'm just going to refer to a slide, and it has a chart which really compares health promotion and disease prevention and how it looks differently. So really the target group that you're looking at with disease prevention is your high risk group. So you're only dealing with people that are engaging in those unhealthy behaviors that might lead to the health issue. Health promotion, of course, you're just dealing with population at large. So this is a message that can go out to anyone and everyone, and they can all work on changing those healthy behaviors. Cause and effect, of course, with disease prevention, you can just really, that issue caused that disease, and you can really just see the cause and effect. With health promotion, since it's a little less direct, there's a lot of different cause and effects, so it's really hard to determine, how we change. It can take maybe 10 years to gather the data when you're dealing with health promotion versus disease prevention. The provider of care, of course, professionals are the ones that are providing intervention for disease prevention. And with health promotion, it's not only professionals, but you have community partners that are engaging in that teaching process. When it comes to strategies for disease prevention, of course the strategies are more traditional versus health promotion, which is more empowering, tapping into advocacy, supporting healthy lifestyles, maybe developing coalitions, and just enhancing resources and really tapping into your community and what resources and maybe speakers are available. Healthy classes that are offered free of charge, like my smoking cessation class, so really tapping into community resources. Of course, with disease prevention, they use the medical model, the trans-theoretical model, which is really talking about behavior change, the stages of change that we go through from not caring about change to starting to contemplate about change, and then of course when they actually, the action phase, which they actually participate in change, but then you have to really support people as they maintain that change. So this is the model that we use in my smoking cessation class. It's a model used in recovery as well as changing behavior. So, and it's, I like this model because it just says people do not have to accomplish a phase and stay there and then technically move to the next one. They can move back and forth. So I might have a day where I'm feeling very empowered, I'm feeling very confident, I'm ready to make that change, I'm ready to give up smoking, and the next day I am not feeling so confident. So the trans-theoretical model really looks through that, and really we use that for behavior change as health coaches and also for people in recovery. And then there's the Pender's health promotion model, which are all used in disease prevention. And of course with health promotion, we're looking at more like the social environment, where the community collaboration is the key. So really tapping into community resources. When you're looking at types of data that are collected, disease prevention can really provide hard data, like if you with drug usage, whereas health promotion, as I already mentioned, is more soft data, and it may take up to 10 years to really observe the change. So disease prevention, you can see the results immediately. Health promotion, it's a little fuzzier, it's more long-term. But as Dr. Morris mentioned, and as I mentioned, the key to longevity is making those changes so that we're healthier for longer and we're not just living on medication in a nursing home for longer. The cost-benefit ratio, of course, it's easier with disease prevention. You can measure how many shots that you've given and how much that cost and how many people were affected and if they developed the flu or didn't develop the flu. Health promotion is really much harder to measure when it comes to the cost-benefit ratio, but we really feel like there's, we support health promotion. So another outcome that we're looking at is just to provide health teaching for individuals. We really want to focus on healthy lifestyles, reducing risks, as well as preventative care, spiritual practices, and what are their developmental needs, and activities of daily living. For our staff health program, when it comes to the preventative care piece, we actually award 30 points or $30 for staff to go to get their regular physical every year. So that's just one way we can engage our staff to encourage them to get those preventative screenings. And they can also earn points when their family member gets a preventative screening. So that's one way we're trying to reach out to families to get them engaged as well. So I know your program might be set up differently than that, but that's just one way we encourage adults to get their preventative screenings. And when it comes to developmental needs, we've taught classes, basic nutrition classes that we call Health Matters. And with those classes, we really keep those to a reading level of 5th grade so that anyone can read it. So just, addressing developmental needs, if you do create your curriculums, your health education, so it is on a lower level, anyone will be able to, learn from the materials. So it just makes it easier for everyone, and we're all on the same level. So, and it's important to, as a faith community nurse, you're promoting faith and health, so you're the representative through active involvement and just being visible in the faith community. So it might involve going to some health fairs and meeting other community partners and just letting them see that you're the contact person, you're the faith and health person at the congregation. Once again, you can convey a sense of well-being, so people see how you act and how you take care of yourself. So really you're modeling all of these behaviors, and that will help encourage people to want to be like you. The faith community nurse promotes health not only as absence of disease, but just having that sense of harmony of the self with self, others, and God. Just having that peace. You're an important person that's going to be disseminating information, helping with advocacy, helping families to advocate for themselves, congregations, as well as the individual, which we kind of talked about when they go to the doctor, teaching them how to advocate for themselves. And also navigating through systems. I think this is so important when we refer people, we give them resources. Sometimes I like to go ahead and just call those resources and see how I get the runaround, basically, when I call. So that way you know, hey, when you call, you need to talk to Joe when you call. Literally, when it came to helping people with one of my positions to get assistance with their MLG bill, their light and gas bill, they kept saying, no, we don't have that available, no, we don't have that available. Well, I called, I cracked the code, so I made the connection. You need to talk to this person, and they will let you know about the program. So sometimes there's those little difficulties in navigating systems that you, depending on what your time and energy and resources are, that you can help with that as well. So health promotion involves teaching people about healthy behaviors, And now I'm just going to refer you to Carrie Beard. She is the supervisor of the Well, which is our child life program where children go while their parents can exercise, but they're also learning about engaging in healthy behaviors through exercise, nutrition, and making and learning how to make choices for themselves as well. Hi, we're with Carrie Beard today, and she's part of our formerly known as Child Life program called The Well. And they do some fantastic health promotion activities for children. And one I see here is called the Plan to Get Healthy. Can you tell me a little bit more about this plan for children?
Yeah, absolutely. So this is what the Plan to Get Healthy looks like. And with each child, 4 years old and up, they get to participate in this program. So basically, the Plan to Get Healthy is health coaching for children. And we tell them a cute little story about Zach and Zoe. One likes to eat better, one likes to get moving, but they don't like to do the same. And once they've identified which one they would like to do, they can self-select under Mind, Body, and Spirit which options they would like to pursue over the next 3 months. So those could consist of maybe drinking more water, or praying and meditating, taking a walk with their family or friends. There's lots of different options, but we let the children self-select those so that they are getting to make those choices instead of the teachers or their parents. And then again, after 3 months, they get to revisit those goals and then select new goals. But at each visit, we make sure to share with their families what their goal setting, what they set as their goal setting, and then we get passionate about that so that their parents can help make that change with them.
And so when it comes to adults and teaching adults, of course, we're busy as adults, so we want information that we can grab and we can use it now. We want to be able to easily process the information. I don't know about you, but I'm tired. I want things that are really relevant to me. Especially, I find that when it comes to eating healthier, as a health coach, one of the things that I talk over and over with staff about is meal preparation. And you've got to take time to go to the grocery store and just set a goal for that every week. And then when you buy those healthy fruits and vegetables, well, guess what? It's going to be a little bit harder to prepare than opening up a package of something. But the healthier choice is going to be preparing the fresh fruits and vegetables. So I always say, once you go shopping, you got to get to the chopping. So in your refrigerator, a lot of time people, they put those fruits and vegetables in the bottom drawer, the crisper, to keep them nice and crisp. But if you never pull them out of the drawer, that can also be referred to as the fruit and vegetable cemetery, where all the fruits and vegetables go to die. So that's why my personal goal when I go to the grocery store is to make sure I'm buying fresh produce with my groceries, but also come home and start chopping it up. And I try to find ingredients that are similar. So maybe in one bowl, I'll prep the vegetables for Monday night's meal, and a separate bowl I'll prep vegetables for Tuesday night's meal, which it makes it so much easier. So finding recipes that are similar, going shopping and then chopping, but you've got to keep up with those shopping trips. And actually, now this is just a little tip which you might already know about, but your local grocery stores sometimes will have where you can pick up the groceries right at the sidewalk. They'll prepare the groceries for you, and all you have to do is pay for them. So it's a fast pickup. So I believe Walmart does this free of charge. I think with Kroger there might be a minimum that you have to pay for your groceries. Some of the pros and cons to that, if you're a busy family, of course, you'll be able to get the shopping done so you have those healthy fruits and vegetables available. So sometimes the con, I've had people say, well, that might not have been the apple that I would have picked out. But at least if you're really busy, at least that's something you can do to stay on track with your goals. So with adults, we've got different topics. You can talk about prenatal care, breastfeeding, fitness, weight management, and advanced directives. And so I brought this. So hopefully you can see that on the screen. Does that look right? This is called 5 Wishes, and this is really one of the most user-friendly advanced directives I have ever seen. I had to help both of my parents fill out an advanced directive, and it was very intimidating for all of us, but this is so user-friendly because it's my wishes for the person I want to make care decisions for me when I cannot, the kind of medical treatment I want or don't want, how comfortable I want to be, how I want people to treat me, and what I want my loved ones to know. And I absolutely love this. It's well used, and if you live in the District of Columbia or one of the 42 states listed below, you can use 5 Wishes and have peace of mind to know that it substantially meets your state's requirements under law. So, and you can look this up online, so 5 Wishes, and you could do a little class on how to fill out this form, and actually we've done that for staff as well. So that's also a really important thing to address with adults and senior adults as well. Having relaxation classes. So I actually do relaxation classes for staff. I'll play soft music, and then you can do visualization. And I did a visualization to, it was a psalm where you're walking through gardens and talking to God. So it doesn't have to be anything that's secular. You can make it, you can use Bible verses with that, because I know some people would feel uncomfortable with that, but really it's just, taking a moment, and I always like to say, cast all your cares on God, so anything that's on your mind, you just imagine placing those in God's hands. So just releasing your worries, then you can walk through a visualization, or you can walk through some relaxing exercises, just like where you're stretching out the neck muscles, because that's where I hold a lot of my tension. And so just being mindful about that, yeah, just tipping your head forward and stretching out the back of your neck, that's really a hard area for me as well. But doing a relaxation class, I think people really respond well to that. It might take a little education and how you deliver that by using some scripture, but there's a lot of resources out there and a lot of beautiful music out there. You could even use hymns if you felt like that it would be an issue with the congregation. But once they got used to it, they are going to be asking you for relaxation classes, I guarantee. So then there's parenting classes, there's healthy cooking on a budget, and especially for seniors, making sure that they stay on track with immunization, and cooking for one, which can be really challenging as well, because then you have all this extra food. So how do you, condense those recipes, still be healthy, but cook for one, because that can be really challenging. So just some things that, just for you to be aware of, just your local and national resources. I like to look up the calendar of health initiatives, so that I can plan some events around those initiatives. May is Employee Health and Fitness Month, and so we celebrate that by we're actually doing some relaxation. We're doing some outdoor fun activities. We did a drum circle, which was a lot of fun. It brought in a lot of community interest as well. And we're bringing in a Tai Chi expert. So that's just one way we're celebrating employee health during the workplace, is bringing in those events, which are fun and interesting for people. So just another resource you can refer to, Center for Disease Control, the CDC. They have a lot of data and research that you can refer to. As we already mentioned, Healthy People 2020. It provides a 10-year agenda for improving health in the U.S. And of course it has information, clinical recommendations, and information on strategies with a wide range of health topics that you can choose from. Medline Plus is also a good resource. It provides up-to-date information about disease, conditions, wellness issues, drugs, and supplements, which is an interesting topic in itself, and the latest treatments and trends. And the World Health Organization, which directs it's the directing and coordinating authority for health within the UN system, and is responsible to provide leadership on global health matters, shaping the research agenda, setting norms and standards, and articulating evidence-based policy. So That is, we're now up to outcome number 4, which is your professional standards to use as a guide for planning your own health promotion programs. And so we have 9 standards here, starting off with an assessment. The Faith Community Nurse collects comprehensive data pertinent to the healthcare consumer's holistic health or situation. So that might include biometric screenings, those questions with the model of healthy living that we referred to earlier, or just getting a needs assessment of what they need. Diagnosis. The Faith Community Nurse analyzes the assessment data to determine the diagnosis or issues. So it just helps you identify strengths, health risks, and issues that need to be addressed, and establish your congregational priorities, so what those needs are. The third piece is outcomes identification. The Faith Community Nurse identifies expected outcomes for a plan individualized to the healthcare consumer or situation. And that's just explaining to the congregation what the outcomes are. So we had this biometric information at the beginning of the year, the biometric again at the end, and look at our healthy outcomes based on our healthy programs. Planning, the Faith Community Nurse develops a plan that prescribes strategies, so that's the strategies you're going to come up with based on your data, and implementation, where you have that, you implement your identified plan. And so just thinking about how you want to address, how you want to teach, employing strategy for holistic, looking at the body, mind, and spirit. Of course, people want to feel comfortable in the environment that they're learning in. And I always find add a little fun to everything that you do. And then of course you want to evaluate your programs, and always, just think about ethics in your practices, reminding people in the group about confidentiality, so that they know. You might, already have that understanding, but making sure that the groups understand if they share, to keep that confidential. And then education, the Faith Community Nurse attains knowledge and competence that reflects current nursing practices. And collaboration, the Faith Community Nurse collaborates with the healthcare consumer, family, and others in the conduct of nursing practice. So as just a representative of Church Health, I just want to say thank you to the Faith Community Nurses for listening to our little segment here today. I want to thank my director and Emmy Oatsky for providing this video for me. And I just want to say thank you to the Faith Community Nurses for the valuable resource that you're going to provide to your congregations. You're really going to be breaking down barriers, helping people get to their appointments sooner, that maybe, by helping them to alleviate some fears. And always just remember, and I know that you'll do this, to make faith fun. And I have a lot of high respect for nurses. I started off in nursing, but it was not for me. So I just want to thank you for your contribution to our communities. And I hope you have a great evening.